age, I think be a bit more careful. So if the pain lasts for too long, then don't ask anyone to walk on the bed, because then you may break all your bones. So what we see what I call red flags. This is what we tell GPs. Because we give a lot of education, we teach all the GPs and so on, so that the GPs, the polyclinic doctors, they will know what we call red flags. So if you have this type of red flags, then maybe the bad thing is not so simple. So if you have pain, maybe you should think about other things. So for instance, if you are very young, so by the time 20 years old, army boys sure got aches and pains, so definitely. But if you are in school already, you have aches and pains, then maybe something not so right. Singapore is so vigorous. I see so many school children, the parents push them to the limit. They go do gymnastics, and their parents I had a child whose parent brought in just for the child, a coach from Belarus, just for that child to teach him gymnastics. And of course he fractured his spine, just because every day 4 hours of training, how to dance. So they actually fracture their spine. But even after a fracture, even after I tell the father insists for him to continue his training because he wants the child to represent Singapore. So Singapore spirit very strong. All changing, preschool, also somehow we're not so affected. Other people here, very affected. So you get the chance to represent Singapore, like that. So this is very important. Right? So of course you have a violent injury, a road traffic accident. If the pain is there all the time, I told you most of these aches and pains come and go, right? But the pain won't go, then you better get worried. Right? If by the time you can't pee, you better be worried. If you ever have a history of cancer, you should worry. Right? Because many cancer doctors don't think about what happens after they've removed the cancer. They think that, you remove the cancer, finish, no more problem. But unfortunately, the truth is that for a lot of people with cancer, it will come back. It will come back even 2-3 years later, 5 years later. So just because you have your breast lump removed, your colon polyp removed, it doesn't mean that it cannot recur. And by the time it goes back to the colon doctor or the breast doctor only examine the breast, they don't know anything else. So when they see the breast doctor say, your breast okay, nothing, don't worry. The guy still say, pain, what to do? Don't worry, jail. So after that happens, the pain gets worse and worse, and the cancer has spread. So in fact, for most people with cancer who are what we call terminal, most times they have already spread to their bones. And the most common site is the backbone. So if you have a history or your relative has a history of cancer and you have pain, don't ignore it. If you feel very stiff, normally you can move, then suddenly, cannot move here, cannot move there, then I think you should worry. Anytime you have nerve pains, you should worry. So you have pain only the back, maybe not so worried. Now suddenly you have pain shooting out your leg, you can't walk, you start limping, you need to worry. Next. So for instance, this is a young man, right? I've seen many doctors before, and then no better. So finally came to see me, I did a scan, he had a tumor, this is a tumor in the spine, right? Next. If you didn't do a scan, you will never have found out. So there are many treatments for these aches and pains. We won't go through them. Right? So you can rest for a few days, lie down is good. Right? Go for massage is good. Wear a corset is good. Go for tuina, 物理治疗, 针灸. All these are good treatments for aches and pains. They all work, but they all work only for a short time. So if you take Panadol, of course it works. You work for 4 hours. You take maybe something stronger, maybe you work for 1 day. You go for massage, you feel very nice for a few hours. If you go for acupuncture, maybe it'll last for a week. So if you try for 5-6 times, few weeks, you're better, don't worry. Don't need to come and see me. Then I don't have to give you a discount. But if you find that, massage, all sorts of pain, still pain, then no choice. Then you better remember my number, so I call up, hey, remember I'm from Chongqing, better. Okay, next. So if you have pain that's persistent, pain is there all the time, don't get better, then, you better come. Right? Especially when you have what we call this red flags, then it's important to come. Next. So what do we do? I think the first thing you need to know is find out what's going on. And how do we find out what's going on? Just by talking to you. So most times, the doctor must listen. And most doctors don't listen, unfortunately. That's why we all entire practice. So, firstly is that first thing you must do, listen. find out what's wrong, you know. You'll be surprised, you know. I got patients who come and see me, you know, they examine them. And finally, I look at the X-ray, your X-ray looks like you got cancer in the bone. How can I? Have you had cancer before? No, never. Are you sure? Never. And I examine her, oh, big lump in the breast, the size of a melon. Oh. The melon, the Japanese melon, this size kind of. I say, how come you got a lump in your breast the size of a melon, you don't tell anyone? Oh, nothing, doctor, nothing. I only come for the backache. You know who this patient was? The nursing officer in my hospital. Yeah. Nursing officer in hospital. So even nurses and doctors go into denial. Right? So when they have something like this, they say, nothing. Don't want to see. Don't want to see. They know already, they know something wrong, but they don't want to admit it. So they don't tell anyone. You know? So even their friend, relative, their doctor, all don't know. Right? And then they have pain and no choice, then they come. Then we become like detectives like that, wondering what is happening. Right? We can manage the pain. We can recommend all sorts of physical conditioning. So we are a bit like personal trainers, except that I'm pretty expensive. So normally they can't afford my personal training. So I delegate it up. So we have physiotherapists, rehab people, and so on and so forth. Then they teach them how to exercise and all that sort of thing. We can do vocational assessment. So those of you company bosses, we actually go to the company, see what is wrong. You know, and so on and so forth. So how come all the workers all getting aches and pains? How come all the senior management is getting aches and pains? I think one thing you have to remember when you are a boss, most people who take MC and say they have aches and pains, actually not because they have aches and pains. What we have found that most people who take MC, when they have aches and pains, actually do so because they are unhappy in the workplace. So that's the other thing. Okay, next. So why do we operate? Usually because of nerve problems. If your nerves are so badly pinched and you can't walk and so on, then the problem is that if you don't do anything, then eventually you will actually not be able to walk anymore. Next. So there are many things you can do. The simplest is this type of thing. We call it a simple operation. Use a knife like this, magic, $5. It's not a knife. This is still the most common operation done throughout the world, even in Singapore. So even if you go to the best top center in Alumni and Gleneagles or wherever, this is the most common operation. Using a knife that costs $5, then you can charge more of it, then you make the difference. So what you do is that you pull the muscle to one side, you take the knife, and then you cut out the slip disc. Next. But there are many other ways to do it. So for instance, this is microsurgery, or what we like to call, what laymen like to call keyhole surgery. So in keyhole surgery, instead of making a big incision, the wound is only the size of a 20-cent coin. Right? So they stay only one day in hospital. So they come in the morning, operation, go home in the afternoon. Next. So next. So these are microsurgery for people with slip disc. This is a slip disc. This is a big piece. Next. Right? This is a big piece here. Next. So this is myself doing the operation. Next. This is the size of the wound. Next. Right. This is the patient 2 weeks after the operation. Next. This is another type of microsurgery. This is even more difficult for us to do. So basically, we put it through a tube, like a toilet roll again. So we put in a little tube, the size of a 20 cm size, 20 centimeter, 20 cent point. But we put the tube down, and the tube protects all the muscles. So we actually operate within the tube. So the idea is that there's no damage to anything. Only thing that's cut is the skin. Everything else, the tube hold apart. When we operate, when we take the tube out, everything is close together. Next. This is the size of the wound. Next. Right. So we can even do this type of surgery awake. So those of you who are brave enough, you can lie down for 1 hour, and we can even do it for you awake. Many times we give them a light anesthesia. So they sleep. Then they wake up and say, "Wow, doctor, over already, I feel very nice." And then they go home the same day. Next. So we use all sorts of funny things. This is a laser machine. Next. This is a special X-ray equipment. Next. Right, all sorts of funny equipment. Next. Next. This is a bit like robotic surgery. When you see your children playing, on the computer and so on, actually we are doing all that. Next. So this is they're operating through this. Right? It's like a little telescope. So the same scope, those of you cannot go and see a urologist and do that to you also. So they can do the same thing.